Hi everyone, my name is Jessica Harnish and I'm a nurse manager in Occupational Health at Whitman-Walker Health, a nonprofit health center with locations in Washington, D.C. We would like to share some information with you about effective use of gloves. Using gloves correctly can help prevent new cases of COVID-19 and can help prevent the spread of germs. Here are some tips on how best and most effectively to use gloves. First, wearing gloves while out in public is not an effective way to prevent COVID-19. Practicing good hand hygiene by washing your hands frequently with soap and water for at least 20 seconds and drying your hands completely offers more protection from COVID-19 than wearing gloves. Aside from washing your hands with soap and water, you can also use hand sanitizer. So I have hand sanitizer here. That's easier, of course, to show you instead, as opposed to washing my hands. So with hand sanitizer, it's meant to deliver enough hand sanitizer in one full pump. So not like a half a pump, but really go all the way down on the pump. So I have a good bit of hand sanitizer in my hand, and I'm going to start rubbing my hands together and covering the backs of my hands, the palms of my hands, in between my fingers, around my thumbs. And for your fingernails, you can scratch the other hand, the palm, with your fingers, and that hand sanitizer will get underneath of your fingernails too. And so you want to continue to rub the hand sanitizer into your hands all the way until the hand sanitizer is completely dry. So once your hands are completely dry, then you can put gloves on for people that do need to wear gloves. I do practice hand hygiene before I reach into a box of gloves. Otherwise, you're starting off with a pair of dirty gloves. So I have gloves here. There's nothing too important to remember about putting them on. Most gloves are not made for a right hand or a left hand unless you're in a surgical service. Once you have the gloves on, realize anything you touch dirties the outside of the gloves. So I've got the gloves on. My hands are clean for right now, but if I go to the grocery store and I touch an orange, whatever germs might have been on that orange are now on the outside of my gloves. So gloves only provide so much protection when it comes to that. We mostly want to see gloves in medical settings. So for removing gloves, I want to make sure that everybody knows how to do that effectively and to prevent the germs from getting on your hands. So the way that I was always taught was to go dirty to dirty and then clean to clean. So what that means is that we consider the outside of both of the gloves to be dirty. And so I can touch with my thumb and forefinger over to the outside of the other glove and begin to turn it inside out. Once I have that off, I can crumple it up into my hand and then clean to clean. So my finger's clean, it's been inside the glove and it was, had hand sanitizer on it before it was inside the glove. So then my wrist is clean also. So I'm gonna go up under, and I normally would go this way. I'm gonna go up under the glove and turn it inside out. And once it's off, we consider the inside relatively clean. Then we would put these in the trash. Never reuse a pair of gloves. Some other things to go over that people don't often think about is that you can still touch surfaces that have COVID-19 on them with your gloves. If you touch your face while wearing those same gloves, then you've likely put yourself at risk of catching COVID-19. The COVID-19 contamination it just goes to wherever you next touch. I mentioned the orange example, but what if you touch your cell phone? Those germs from the gloves are now on your cell phone. You put your cell phone up to your face and again, they're on your face. Oh, I should have mentioned, once you take the gloves off, it's appropriate to use hand hygiene again. So hand sanitizer is usually most convenient for many of us when we're out in the world. So again, we are rubbing it in. Other things you can do for under your nails is to use a nail file, especially with running water. I like to do that, or to use a nail brush. I don't have one of those at the moment, or I would show it to you, but that's again more for washing your hands than it is for hand sanitizer. I do like to wash my hands every, 5 or 10 uses of hand sanitizer. Otherwise, you'll start to notice that the hand sanitizer starts to feel kind of gummy on your hands. So when I'm able to, I do like to wash my hands periodically. Remember, of course, that glove use alone and hand hygiene use alone and mask use alone cannot effectively prevent the spread of COVID-19. We need all of those together, plus maintaining a 6-foot social distance from others in order to effectively prevent the spread of COVID-19. If you're experiencing symptoms related to COVID-19, please call our Whitman-Walker team at 202-745-7000. They can do a phone evaluation of your symptoms and schedule an appointment for COVID-19 testing at our Northwest or Southeast Center. I just want to thank you for watching, listening, and learning, and for learning more about containing the spread of COVID-19. Thanks.